Prime Minister has struck a public hospital funding deal with the states, committing an extra $25 billion in federal spending over 5 years. As part of the agreement, the Commonwealth and the states will also seek to reduce spending growth on the National Disability Insurance Scheme to 6%. The deal, signed at National Cabinet, ends a lengthy standoff between the Commonwealth and the states.
This agreement represents one of the most significant national reforms in living memory. These reforms will ensure that Australians can continue to access world-class healthcare as well as disability supports. It prioritises investment in our precious public health system and builds on my government's measures to strengthen Medicare. It is a major step forward in addressing the pressures that are there on our health and aged care systems as well as on the NDIS, ensuring their sustainability into the future.
Let's go through the detail on that deal now. Here's political reporter Samantha Dick from Parliament House in Canberra. Hi again, Sam. So what have the states and territories secured?
Hi there, Roz. So as you've heard there, the Albanese government has finally landed a deal with the states and territories to secure a new 5-year funding agreement for public hospitals after months of intense negotiation. So essentially, the states and territories have been demanding more federal funding to help them manage the huge costs associated with running public hospitals. And that's partly due to this increased demand for services as a result of Australia's growing and ageing population. Adding to that is the fact that right across Australia, we have thousands of aged care patients who are languishing inside public hospitals because they're still waiting for a bed inside a residential aged care facility. So that's also adding pressure to under-resourced hospitals across Australia. So the latest offer from the federal government prior to today was an extra $21 billion over 5 years, plus an additional $2 billion to help manage those aged care patients, bringing us to a total of $23 billion. But today we've heard that the Albanese government has now made a new offer of an extra $25 billion, which has been accepted by the states and territories. They've obviously welcomed this announcement. It's good to finally have a resolution, although the premiers and chief ministers say that there is always room for more.
This has been some 2-year journey. There's been some very strong advocacy from all premiers and chief ministers to best represent their communities, and this outcome, as I say again today, is welcome.
In terms of this deal, which is a significant deal, if you're asking me whether or not I would have liked to have seen more, of course, and if you're asking whether or not we're going to fight for more in the future, you bet. But we've taken a really big step forward today.
This is going to go a long way. I certainly share with Queensland, you could always have more, and we'll continue to put up a really good fight on behalf of the territory. But today is significant and it's something to celebrate.
One of the challenges the Prime Minister's facing, as well as all the premiers, is that we've got an ageing cohort. So as much as the system is stretched today, we can expect even further problems in the future. But we're very grateful that we've got this agreement today.
So, Sam, take us through the changes to disability support programs.
Yeah, well, disability support for Australians was another big topic discussed at this meeting of National Cabinet in Sydney today, and it does tie into this debate around public hospital funding. So back in 2023, the federal government offered to up its share of public hospital funding in exchange for the states and territories taking on more responsibility for providing some disability support services to take pressure off the NDIS. So the NDIS is an extremely fast-growing area of expenditure for the Commonwealth, and as an attempt to alleviate some of this pressure on this big budget blowout that we're seeing with the NDIS, the government has announced last year a new program called Thriving Kids, which is meant to reduce the pressure on the NDIS by redirecting some children with mild developmental delays and autism away from the NDIS and onto this new program called Thriving Kids, which is co-funded by the states and territories. Now, this new program was meant to start in July of this year, but the states and territories were worried that they didn't have enough time and they weren't going to be ready for this rollout date. So they've asked Prime Minister Anthony Albanese to push back this start date by a couple of months to give them a little bit of extra time. The Prime Minister, Anthony Albanese, responded to those requests today.
The states put to us the possibility of a short delay in the full implementation of Thriving Kids. But Thriving Kids will start from this year, and the full implementation will be completed on the 1st of January 2028. We agreed to that proposal. It was reasonable that we get this right, and so it is a positive move.
There are still, of course, a lot of questions about how this new program, Thriving Kids, will work. And a lot of parents across Australia are concerned about what's going to happen to their children once Thriving Kids comes into effect and their kids are moved off the NDIS. But now that this public hospital agreement has been signed, we are expecting to see a few more of those finer details worked out in coming months.